June is National Migraine and Headache Awareness Month. Local 3's Brianna McLean is in the studio on this week's Aspirus Medical Monday. Brianna?
On this Aspirus Medical Monday, we are focusing on raising awareness about migraines and other headache diseases. According to headaches.org, migraines impact 40 million people in the United States, 1 billion people across the globe, and is recognized as the #2 cause of disability worldwide. To talk more about this is Jeff Berry, the Director of Regional Therapy Services for Aspirus in the UP. Jeff, to start off, would you explain the difference between a migraine and a headache?
There's actually 150 different types of headaches. Migraine is one of those types, and it's the second most common type. The most common is actually tension headaches, but migraines do differ from the common tension headache in that they typically last longer, and they also have other symptoms associated with them. So the symptoms are like nausea, vomiting, sensitivity to light and sound, as well as a sensation or an aura is often present prior to the headache. So that aura can be changes in your visual field. It can be flashing lights, numbness on your face, and changes to your sense of taste and smell.
What are the causes for migraines and headaches?
Truthfully, migraines aren't fully understood, but migraines, just like a lot of other common headaches, there are triggers that are associated with these headaches that are commonly external triggers. So these triggers can include poor posture, noise, depression, lack of sleep, diet, stress, eye strain at the computer. Because there are so many different types of triggers, it's really important actually for patients or migraine sufferers to track their symptoms. Oftentimes I'll have patients create a log of what they were doing prior to their headache, what they ate, the situation they're in, the posture they're in. That can really help all healthcare professionals kind of come up with a treatment plan to best treat the migraines or the headaches.
What are some treatment options for individuals who suffer from headache or migraine pain?
The most important part is you need to consult your primary care provider. As I mentioned earlier, there are a lot of triggers. Not all of them are physical. So talking this over with your physician can help identify areas of stress, depression, maybe your diet, and there's different modalities that the physicians can use to help with those factors. Speaking from a physical therapist point of view, we often will be treating the musculoskeletal component of headaches, which is one major trigger, especially for tension headaches. So we'll be looking at a common posture, which is in a seated posture, we often slouch. And when we slouch, we often extend our spine or extend our neck. And when that happens, we put pressure on the back of your neck, which then causes headache or causes tension up your neck into your head. So the treatments that we will provide are often some manual therapy techniques that will take pressure off of those areas, along with therapeutic exercise to help maintain the mobility and strength in your neck. Most importantly, though, it's actually the home exercise program that is given to a patient that they can do on their own to help manage and maintain the improvements with therapy.
Thank you, Jeff, for joining me on this Aspirus Medical Monday. To learn more about Aspirus Health's specialized treatment options for patients who suffer from headache or migraine pain, you can visit aspirus.org/headache-therapy. In the studio, Brianna McLean, Local 3 News.